Alrighty, for this lecture, it's going to be on the skeletal system. Specifically of the upper extremity. So all that means is that it is on your arm. Now we're going to start with the scapula. For this, I'm going to actually draw two different views of it. Actually, essentially three different views. I'm actually going to draw the left scapula, just so you have a little reference of which side we're drawing. We could also do the right, but of course it'll be on the same on the right side. So let's start by drawing an anterior view. As always, feel free to draw along with me or kind of pause and come on back once you've drawn it all out. Alright, so that's our anterior view. Since we're looking at the left scapula, the front of it, this is going to be medial and this is going to be lateral. Alright, let's also draw a posterior view. And with that, oh, you know what? I'm actually going to draw, so this is your scapula, this thing as a whole, but I'm actually going to draw a humerus in right here. I'm drawing it a little bit separated from the scapula. Really, this part of the humerus is attached right directly to it, but I'm drawing it a little bit away from it, just so we remember that that's where the humerus attaches. So I'll actually do the same thing over here for the posterior view. Since we're looking at the back of the left scapula, there's going to be a humerus right here. And then I'll draw the rest of the scapula out here. Alrighty, sweet. So we have both of those views so far. I'm actually going to do one more. I'm going to do a medial view. So we have anterior view, posterior view, and now medial view. And this means we're looking at the medial part of the scapula. So it's going to be, your scapula is actually like really thin, so make sure you're looking at the models as you're going over this, because we're going to just look at it as a super thin structure from the side. Alrighty. Sweet. So let's start labeling. Oh, you know what? Actually, this is going to be lateral. This is going to be medial. And then this is going to be anterior, and this is going to be posterior. Let's make sure that we get all those guys in there. Okay, let's start labeling. We have the acromion, which is right here. And also right here. That's a part that sticks over and almost kind of forms like a little roof over where the humerus attaches right here onto the scapula. And that's important because depending on the shape of your acromion, here I'll write it out so we have that word, acromion. Depending on the shape of your acromion, what it can do is if it's a little more curved over our humerus, our arm bone right there, it can lead to some damage or breakdown of the tendons that pass over the humerus and under the acromion right there. So this is really important that one, we know where the acromion is, and two, we know what it looks like in imaging, because if we have an idea of what it looks like in imaging, it can help us understand why people have certain injuries to the tendons that travel under the acromion. Now, the acromion is at the end of something that we call the spine of the scapula. So if you're ever like doing quiz questions and stuff like that, or if you're writing about anything, remember we have our other spine as well. So like our main spine with all of our vertebrae. So if you're ever going to be talking about the spine of the scapula, make sure that you say that it's of the scapula instead of just of the body, just so we keep it clear. Next we have our coracoid process, which is a structure that sticks out anteriorly, which is right here, and you can see it a little bit posteriorly as well. Coracoid process. Then we have something called our suprascapular notch. Now, supra means above, so this means a notch above or at the top of the scapula. So I'm going to draw it anteriorly and posteriorly. We just have some different things that travel through that notch. We're not going to go over that because it's beyond the scope of this course, but just know that that's why we have a notch there. We always have things in places for a purpose in anatomy. Suprascapular notch. Now we have a medial and lateral border of the scapula. So remember, this M stands for medial, so it's on the medial side. So I'm just gonna draw right along the border in this nice like dark teal color. That's gonna be our medial border over there. We can also see it on the posterior side. Oftentimes people who have pain coming from the nerve roots in their cervical spine will get a referral of pain around the medial border of the scapula. So that's oftentimes how I see that term used clinically. So this is the medial border. Now we also have, like I mentioned, the lateral border, which is on the lateral side. So since our scapula is like our shoulder blade and it forms a joint with with the humerus bone right here, it's really important for stability of that shoulder joint as a whole. Now, what also helps stabilize those the shoulder joint as a whole is muscles, and muscles attach on a couple of different fossas, and a fossa is just like a shallow like divot in the scapula. So I'm going to show you one fossa. It is going to be, remember, so here we're looking at the anterior view of the scapula. So this is the front of the scapula. That's going to be squished up against the rib cage. So just note that. And I'm not going to color the whole thing in, but I'm going to give you a basic little coloring of this area here, because that's about where the fossa is. And that is called our subscapular fossa. And it's just like a little shallow opening, just kind of shaped like that. All right. Now we have a few other fossas where muscles attach as well. We have a supraspinous fossa, which is, remember, this is the spine of the scapula. Now above it, we have the supraspinous fossa right in here. And then if we have a supraspinous fossa, meaning above the spine, we're also going to have an infraspinous fossa, which is below the spine. Right here. Alrighty. Now, a few other things to label. We have something called our glenoid cavity, and that is right here. Cavity meaning just like a little divot here on both sides. That is what forms a joint with a humerus bone or the arm bone right here. That's our glenoid cavity. Now there's something that sits more superficial to the glenoid cavity, and it's actually a soft tissue structure. It's not bone, but I'm going to draw it in right here. It sits, remember, superficially to the glenoid, and it serves as like a shock absorber and stabilizer for the joint. It's called the labrum. So remember, that's not bone. You're not going to be able to see it on the models. You may be able to see it on one of the joint models. I can't remember. But anyway, that is your labrum. And then the one last thing that I forgot to label that I want to for us is our humerus, just so we know what's sticking around here. That's our big arm bone right here. All right, now let's look at the medial view. Oops, I forgot to color some things in. So we have our acromion coming around the side right here. And then we have our coracoid process and more anteriorly. Then we have our, you can see part of the glenoid fossa around the edges. But in the center, you're going to be able to only see the labrum most medially there. Now, I want to point out two little dots here, and they're just important because they're where certain muscles attach. The first one is our supraglenoid tubercle. So remember, this maroon thing is called our glenoid cavity. Above it, we're going to have the supraglenoid tubercle. which is just like a little, almost like a bony protuberance, but it's pretty small. So let's add in that. Supraglenoid tubercle. Oops, LE. Tubercle. That E is unusually large, so sorry about that. And if we have a supraglenoid tubercle, what do you think we're also going to have? That's right, we're going to have a infraglenoid tubercle down here, right below the glenoid. Sometimes the glenoid cavity is just called the glenoid, or referred to as a glenoid. So most of these places on bones are important, remember, because they're where muscles attach. So there are muscles that are going to attach onto these tubercles, onto the coracoid process, and onto like these fossas, for example. So that's really the reason why we have to know in such detail the scapula and other bones in such detail, because they're important places where muscles will attach. Now let's take a closer look at this humerus and some of your other arm bones. So we got the shoulder blade or the scapula done from multiple different views. Now we're going to take a closer look at the arm. So we're still on upper extremity of the skeletal system, but we're going to move to the arm and forearm. So remember from our anatomical terms, we talked about the upper arm as the arm, and then the forearm as the forearm, rather than referring to the whole upper extremity as just the arm. Alrighty, so let's take a look at, remember how we looked at the left scapula? Let's take a look at like the right arm. We'll switch it up a little bit. Arm and forearm. So let's do an anterior view first, and then we can also do a posterior view. Alrighty, let's start with the humerus. I'll write the humerus at an angle here, just so we know where we're at. All right. Again, draw along with me. Alrighty, there's our humerus anteriorly. Now let's draw it out posteriorly as well. Sweet. Okay, we have our humerus you know, now let's actually add in our forearm as well. So our forearm is a little more complicated than just thinking about it as one bone. It is actually two bones. So let's take a closer look at that. We're going to have our radius here more laterally. So let's actually label lateral and medial. And then this is going to be medial and lateral. So let's start out with our radius. I'm going to draw our radius and ulna a little bit separate. Those are two forearm bones. I'm going to draw them a little bit separated from the humerus, but just know that they're actually close together and they're actually squished right on top next to each other, and they're touching to form a joint. It just makes it easier if we draw them a little bit separated here. All right, so that big bone is called our ulna. So I'll write that right here, our ulna. And then now let's draw in the radius. Sweet. Okay, so now we have an anterior view of that. Now let's draw a posterior view. So again, this was our humerus here. Now we're going to have our, medially is always going to be our ulna. And then laterally we're going to have our radius. Alrighty. So let's get going with our ulna first. And then we're going to draw in our radius. Sweet, now we have all of the bones we need. Now it's our job to just label everything. Alrighty, let's start with the head. Now, in our upper extremity here, we have a couple of different heads. We have the head of the humerus, which is right here. That is what articulates or forms a joint with the glenoid fossa. Also known as the glenoid cavity. So we're going to have the head up there, and then let's also label the head of the humerus. Oops, excuse me, of the radius. All right, so I'm just going to put one label down below. I'm going to say the head, and then say that we have one of the humerus and radius. So same thing with the neck. We're going to have the neck of the humerus right here. This is the anatomical neck. We also have something called the surgical neck, but that's only of the humerus, not of the radius. So let's just write in, oops, I always like to have bullets here so we know where we're at. There we go. anatomical neck. And that is of the humerus. And we don't really call it the anatomical neck of the radius, we just call it the neck. But I'm gonna, radius. But I'm gonna include it as, you know, as a group, just to keep things simple for us. Now, remember I mentioned we also have a surgical neck, so let's draw that in. That is going to be right here, just because that's oftentimes a place where surgery will occur, hence the name. And that's only going to be of the humerus, like I mentioned. So, surgical neck. Now we have a place. Remember, we were kind of talking about the importance of muscles and different landmarks on muscles. And they're important because that's where muscles attach. Oops, excuse me. I meant to say landmarks on bones because that's where muscles attach. We have a landmark right here, which is this little bump sticking out right here. And that is actually called our deltoid tuberosity because that's where our deltoid muscle attaches. You can also see it posteriorly, but I messed up and didn't really draw a little bump, so that's our little bump. And pretend it's all colored in pink, but you can just see a little bit of it right there. Alrighty, now we have next medial and lateral epicondyles. So those are this thing and this thing popping out. You can also see them posteriorly here and here. If you've ever heard of medial or lateral epicondylitis, you have a lot of, that's also known as tennis elbow or golfer's elbow. You have a lot of muscles that attach, like pretty much most of your forearm muscles come up and attach on either the medial or lateral epicondyles at some point. If they do attach to the humerus, and with those muscles attaching there, if they're overused, they can become sore and people can have pain right at these epicondyles right here. So let's label them. We have medial and lateral. Epicondyle. Now remember how epi means above? Well, that's important because this structure right here is our condyle. We don't really call it that though. We actually have a couple of different names for it. But our condyle there, the only reason I'm saying that name, it's not really used much, but I'm saying that because you can remember this bottom part being a condyle and the part above it being epicondyle, since epi means above. But the true name for our condyle here that's split up into different parts, or what's commonly used, is this part most medial, which you can see both anteriorly and posteriorly, is our trochlea. Now, what's right next to the trochlea, right here that you can see anteriorly, you can't see it posteriorly though. That is called our capitulum. And a way that you can kind of remember the capitulum's relationship to the radius is you can think of the head of the radius right here. And what do you put on your head? You put a cap. So your cap or your capitulum articulates or forms a joint with the head of your radius right there, which is how you can kind of remember how things are arranged. Now we also have on the humerus, we have the olecranon fossa, which is this fossa, or a little like almost like indentation in there to allow for something called our olecranon, which we're going to label there in a moment. But let's first just add in olecranon fossa. Now, I think that covers... Oh, we also have a few more things on our humerus that I don't want to forget about. We have our greater tubercle, which is right here and right here. That's just another area where bones can attach. And then if we have a greater tubercle, what are we also going to have? That's right, we're going to have a lesser tubercle. So that's going to be right here. And you can actually only see that on the anterior view. Alrighty. Now let's start labeling things on the radius and ulna. So I'm just going to draw a little line here to signify that, hey, you know what? We're moving into things that are just on the forearm. The only thing that was shared for both of these was the head and anatomical neck on the radius, but now we're moving into just forearm territory. So again, remember your ulna is always medial, your radius is always lateral in anatomical position. Now let's label something called our radial tuberosity. And that is going to be right here. And that radial tuberosity is one of the places where the radius connects to the ulna. So just remember, everything has a purpose here. So we can also see the radial tuberosity a little bit on the posterior view, but it's much more visible in the anterior view. Now remember, we have this olecranon fossa, and that's basically a little hole or divot to make room for something called the olecranon, which is right here. So the olecranon, it's actually called olecranon process, is this structure right here. And then you can also see some of it alongside the anterior side. So I'm just going to draw a little outline of where that is. Now, what I want you to do is take a moment and just touch like the most bony part of your elbow, like right here. That is this part on your olecranon. Okay, so this is actually like part of your elbow right there. And this olecranon process is going to come in and like articulate or form a joint with and fit very well into this olecranon fossa. Now we're also going to have something called the trochlear notch, which is a little notch on the anterior side of the olecranon process. And it's, let me draw that in first. It's the red area right here. And that trochlear notch, of course, is a notch that's going to articulate or form a joint with the trochlea right here. Now the last thing that I want us to label here is something called the styloid process. Remember, we had one of those up in the skull as well. but this one is a little different just based on location. So we're actually going to have the styloid process of the radius and the ulna. So I'm just going to draw in this peach color. It's always going to be most lateral or most medial. These little pieces poking out right there. So again, that is styloid process. And then we have one of the ulna and the radius. So that covers our arm and forearm, and remember we drew the right one here. Now let's move our way into the hand and the wrist. So here is our wrist and hand. Alrighty, so let's draw this out. Remember we ended at the forearm, so we're going to start at the forearm again. Let's draw our wrist out. This is going to be an anterior or like palmar view. And so this is actually going to be someone's right hand. All right, so let's draw out. We're gonna draw the the most distal aspect of the radius. So that's our radius right there, and then I'm gonna draw also the most distal aspect of the ulna. Okay, so that's the distal forearm, and now we're moving into the wrist. So let's start. We actually have quite a few little wrist bones, and they're actually called carpal bones. So I'm going to start by drawing those out. All right, sweet. It just looks like a little pile, but it's going to make a lot more sense to us in a moment. But let's also draw the rest of the bones out. We're almost there. Just gotta do the last of these fingers, and then we'll be good to go. Alrighty, sweet. Now let's start labeling some stuff. Let's start with, there's actually a little acronym for how to memorize these carpal bones. So let's first label our different forearm bones that we drew, and then we'll get into our little acronym to remember the other stuff. So here, remember on our medial, or our lateral side, actually, let me draw this. This is gonna be lateral, and this is medial, because here's our thumb, and then here's our radius. So our radius, let's draw, let's color here. And then we'll also have our ulna. Alrighty. Now let's get into our carpal bones. The first one is our scaphoid. That bone is actually really interesting and important because it's the most commonly injured carpal bone, and what makes it special is that there is actually a really unique way that blood is supplied to that bone. So you're at risk with a fracture of cutting off some of that blood supply to part of the bone, and what that can lead to is something called tissue necrosis or tissue death. So it's really dangerous to break that bone and not have it checked out, because when tissues die, it becomes painful and harmful. So it's something that we really want to be aware of with that most commonly fractured or injured bone. Now we have the lunate bone, which is right here. And these carpal bones really are packed together that tightly, so just keep that in mind. And this is just like your whole wrist right here. Now next we have the triquetrum. There are 3 carpal bones that start with a T, so make sure you don't get them confused. Triquetrum. And sitting right on top of the triquetrum is our pisiform. If you actually put your hand on your wrist here and feel for one of your wrist bones kind of sticking out, you can actually feel like a little lump where the pisiform is. You can feel it kind of sticking out there. The next bone is another bone that starts with a T, and we're gonna always go from lateral to medial when we're naming them for this little acronym that I'm going to tell you. But this bone right here is called the trapezium. So remember, it's pretty close, so we want to keep those names a little separate there. Right here. Trapezium. So I'll put a little line here because those ones are our proximal row, and then these ones are our distal row. So anyway, we did trapezium, and then our next one is trapezoid, which again makes it kind of confusing with all the T names in there. Trapezoid. Then we have capitate. Make sure you don't get this confused with capitulum on the humerus, because people do sometimes. And then the last bone for us to know is the hamate. I always think about kind of putting this edge of my wrist on a slice of ham. I don't know. I have the weirdest way for remembering things, but it works. So that's our hamate. So let me just make a note that these are proximal and these are distal. Okay. So the acronym for that is that, I mean, there are a bunch of them out there, so but the one that I remembered is some lovers try positions that they can't handle. So Google, or sorry, it's not an acronym, but it's a mnemonic. If you Google like carpal bones mnemonics, you can find a bunch of different ones and just find whichever one works for you. Now, next we have our metacarpal bones. So I'm gonna actually put these in a little box to make sure we differentiate them from the other ones. Now we have metacarpals, which is the next row, and for all of these they're actually going to be numbered. So I'm gonna number our fingers. Our thumb is always number 1, and then it goes from there all the way to our 5th. We call them digits, or we call fingers digits. So your pinky here is your 5th digit and your thumb here is your 1st digit. And that's also how we label the different aspects of this. So let's start by coloring in our metacarpals. This looks like a cool green skeleton hand now. I'm happy with this color choice. Alrighty. Metacarpal bones. So this one is our first metacarpal, second metacarpal, third, etc. Now for the other little bones in our fingers, those are called a single one is called a phalanx, and multiple ones are called phalanges. You may remember that from Friends. I can't remember, I think it was Phoebe talking about that, if you're a Friends fan. But anyway, those are our proximal and, oops, I just realized that I'm missing a bunch of finger parts right here. So give me 1 second. I fused some of our finger bones. That's not cool. So after the after the metacarpals, we have 3 more bones, and I fused them on accident. Oops. So this thumb one is the only one that's a full, we're gonna make this blue. So I was drawing the thumb, and the thumb is a little bit different than all the other bones, which is why I totally messed up and made a mistake on all the other ones. So give me 1 second, just separate these guys out. So I fused all of our other finger bones on accident and combined 2 into 1. So we're gonna label our proximal phalanx. So remember, when we're talking about extremities, proximal is closer to the center of the body. So these are gonna be, it's gonna be a proximal phalanx or phalanges. And we're going to talk about the numbers in the same way. So this is going to be our first proximal phalanx, second proximal phalanx, etc. We're also going to have middle phalanx. So let's color that in right here. Now, the only fingers that are going to have the middle phalanx are going to be digits 2 through 5 because the thumb is shorter and it's special, so it only has a proximal and distal phalanx. But these are going to be, it's going to be our middle phalanx. Ooh, I'm just messing up here. Phalanx. There we go. And then lastly, we're going to have our distal phalanx on each finger. There we go. See, good as new. Fixed it. And I'm just gonna put a little note here. Plural is phalanges. Alrighty, we're rolling now. So we got our thumb all taken care of. Just basically, let me write down a little example of how we would talk about this. So we'd say, for example, our fifth proximal phalanx. That would be this dark blue piece right here. So that's just an example of how we talk about these finger bones. All right. Now, I just want to draw your attention to a couple more terms. It's just going to be important as we get into muscles and everything like that. Whenever we're referring to the thumb, we always use the word pollex or pollicis. For example, there's a muscle, you don't need to know this now, but there's something called like abductor pollicis longus, and that's basically a muscle that's pretty long and it does an action on the thumb. So whenever we use the word pollex or pollicis, we are referring to the thumb. Now this covers all of, or we covered in this video, we covered our upper extremity, including our humerus, radius, and ulna, and then we just covered our wrist and hand, so all of our carpal bones, and then we covered our metacarpals, our proximal, middle, and distal phalanges, and then we numbered all of these. So remember, all of these numbers count for the metacarpals and all of the phalanges as well. So that wraps up our upper extremity.